Hey guys, it's Dr. Jyoti Patel and welcome to my Facebook Live. Today I'm going to be talking about how to prepare yourself for a potential hospitalization or a potential hospitalization for a loved one. For those of you who don't know me, I'm Dr. Jyoti Patel. I practice both internal medicine and pediatrics, and I'm board certified in integrative and functional medicine. So during these uncertain times, one of our biggest fears is getting seriously sick and requiring a hospitalization. And in the last 17 years as an internist and a pediatrician, I've admitted my patients to the hospital. As a cancer survivor, having multiple surgeries, I've been a patient myself. And recently, because a loved one had to be hospitalized and was in the ICU for cardiopulmonary conditions, I had to be a medical advocate. So the reason why I'm doing this live is because I know how important it is for us to know how to prepare for a hospitalization. So this is for educational purposes only. Share with anyone who can benefit. If you are joining me live, feel free to post a comment or let me know if you have any questions along the way. As you know, I love answering questions. So this is not just about COVID-19, even though this is what we're facing right now is this potential hospitalization, but it is for any condition that you may have or loved one may have. So just because we're dealing with a pandemic right now doesn't mean that we don't have heart attacks and we don't have strokes and we don't have appendicitis and we don't have other reasons why you may end up in the emergency room or get hospitalized. So my recommendations today are for you to take home so that you know what questions to ask, how to prepare for hospitalization, and what to expect if you do end up going into the hospital. So welcome this afternoon. All right, so let's get to what the topic is today. Last week, I talked a lot about prevention for COVID-19. Talked about social distancing, hand washing, avoiding touching your face, the importance of personal protective equipment, and staying home, along with ways to boost your immune system. Last week, I talked about the innate and acquired immunity and how it's so important for us to live a healthy lifestyle with nutrition, attention to our gut health, our microbiome, decreasing our stress levels, helping improve our sleep, our exercise, our movement, and most importantly, human connection. So again, coming off from that talk, I just want to talk about what to look for if you are worried that you should go into the hospital. This virus is very long in terms of its incubation period. It may be 2 weeks from the time of contact with the virus that you start manifesting symptoms. So you may take up to 2 weeks before you show any symptoms. And 50% or more of patients may be completely asymptomatic, or they may have mild symptoms such as fever, headache, sore throat, cough. After day 5, so what happens with the virus? So I like to talk about this. The virus is like a gang of thieves. It comes into your nose, your mouth, your eyes, through your airway, respiratory tract, and then attaches itself to the mucosal cell on a receptor we called ACE2, okay? Once it attaches itself to this receptor, the gang of thieves breaks into your house, into your cell, raids your fridge and your pantry, makes a mess of your home, makes 10,000 babies, and then floods your neighborhood. So when that happens, the local police, which is your innate immunity, comes to check out the neighborhood. And in that process, you might discover you are experiencing fever, headache, cough, congestion. These are mild symptoms, and for the most part, if you're not having any serious conditions here, I recommend not going to the hospital or the emergency room because you might in fact pick up other things. So these mild symptoms can be treated at home. Now, some of those patients will progress on. After day 5, you might start to experience more chest pain, fever, cough, difficulty breathing. We call this acute respiratory distress. In this case, you do need to seek medical advice. If you go into your local doctor's office and get tested for COVID-19, or you go to an urgent care or an emergency room, typically they'll do blood tests, which they might find a lower white count, or they might do a chest x-ray and see some bilateral haziness, and that's the first signs of some type of infection and inflammation in the lungs. What happens in the immune system is that the first line of defense is now calling in the National Guard, okay? They're calling in the Army. And they do that through chemical messages. And you may have heard of these terms: cytokines, inflammasomes, NF-kappa B, IL-1, IL-6, IL-18. These are all distress calls that your innate immunity and your acquired immunity are sending out to get more help into the area. Okay, when this happens, we call this cytokine storm. You've heard of this term before as well. This requires hospitalization because when the immune system has a hyper response to this infection and now it's spewing out a lot of inflammatory cytokines, the body gets more and more inflamed. And where that happens is in the lungs. The lungs start to build up with fluid. It becomes harder to breathe. It causes chest pain, shortness of breath, fatigue, malaise, dehydration can ensue. So these are times that you definitely want to seek medical attention. When you go into the emergency room, they will do blood tests. And what we know about this virus is it causes your white blood cells to tank, your lymphocytes to tank, your platelets to tank. It causes your ferritin levels to go up. It causes your inflammation markers like a CRP or IL-6 to go up. It causes changes in your blood clotting ability. Your bleeding time becomes long and you're more likely to bleed. Your liver enzymes might climb. So I describe all of this because it's really important to seek medical care during this phase so that we can approach this more rapidly and we can get to you quicker. Now, how do you prepare for that potential hospitalization for you and your loved ones? Number one, keep a health file, okay? So I'm going to tell you what you're going to put in your health file. And you can do this now while you're still well, because inevitably somewhere along the way, you or your loved one may need to get hospitalized, and this is going to come in handy no matter what the condition. So first is a copy of your ID, your driver's license or any type of ID that you keep. Second is a copy of your insurance card, front and back. Make sure that's in your folder, okay? Third, you want to ask your primary care doctor for a copy of your last physical exam. Typically, that note should include your medical conditions, should include your past surgeries, should include your medications, your allergies to medications, your family history, your social history. So if you don't have access to your last set of blood work or your last physical exam, start typing this up. It's good to have record of everything that's happened to you because this is going to be asked of you multiple times in the hospital, in the emergency room, by the nurse that's triaging you, by the emergency doctor, by the hospitalist that admits you, by the cardiologist, the pulmonologist, the ICU attending. They're all going to want the same information. So if you prep ahead of time by having a list of your past medical history, your past conditions, your past surgeries, your medications, what you're allergic to, what your family history is like, what your social history is like, whether you drink, whether you smoke, whether you've had any other problems that you want to report, put that down on that piece of paper. Also, make a list of your doctors and their contact numbers. Put that in the folder. Next, put a list of family members that you want to be contacted in case somebody needs to be talked to, right? Because sometimes you might not be conscious, or you may not have the ability to make medical decisions. You want to make sure that your family members are listed in this form, including their phone numbers. In this time, we're not allowing excessive number of family members to join you in the hospital room. So you will be there by yourselves, which will be difficult, but not unsurmountable. And I'm going to help you through that, okay? So if you prepare your health folder and you include these items in there, it's going to help you. Another thing, advanced directives. One of the most important things that I talk to my patients about every time they come in for their annual physical is their advanced directives. This is a form that I can link to the comments later, or you can pull it off online. It tells us doctors who you want designated as your decision maker. If you are not able to make medical decisions for yourself, who should we contact to let us know what you want done? You have to list 3, okay? Number 1, number 2, and number 3. This advanced directive also has 3 questions that it asks you. If you're in a coma, if you have brain damage, or if you have a short time to live, What would you want doctors to do to help prolong life? These are really important questions. Let me tell you guys, you don't want to be the family member having to make decisions for someone, and you don't, as a person, want your family members to be put in that position where they have to make that decision for you. So if you've thought this through and you've put that down in your advanced directives, it makes it a lot easier. Doesn't matter which decision you go with. It makes it just a lot easier for the people who are caring for you to know what your wishes were. Okay, so this advanced directive is really important. If you're taking care of an elderly parent or loved one, and they have a DNR order, or they have made you the power of attorney for their health care, make sure you put a copy of that in their health file. Because during times of stress, when the EMTs arrive and everyone's rushing in, it's difficult to try to sort and find all this paperwork. And we in the healthcare field are obligated to do everything possible unless somebody tells us otherwise or shows us papers otherwise. So if you want to spare your loved one any unnecessary procedures, this is a really important piece of paper to put in their health file. You also want to have a timeline. Okay, so now I know this is really difficult to kind of anticipate or predict, but I'm going to tell you by far, it's the most important thing that I've done for my loved one, is to keep a timeline of when things started to go south. When was the first time they got sick? When did they have fever? When did the cough ensue? When did chest pain occur? If they went to see their doctor, what tests were performed, what chest x-ray was done, what medications or antibiotics were given, so that the doctors treating you in the hospital don't have to go looking for that information. You've got it all ready for them. Timeline, this happened, and this happened, and this happened, and this was given, and this is how it happened. People that are prepared will streamline through all that garbage and get right to the diagnosis and treatment necessary. So you're going to be your own health advocate by making sure that your doctors and your nurses know exactly what's happened to you when it happened. What made it better? What made it worse? What was given and treated? What tests were done? All of it, okay? More information you provide to your healthcare providers, the quicker it's going to be for them to figure out what's wrong. Remember what I said in the beginning. It can be COVID-19 or it could be appendicitis. The more information you provide to your healthcare providers, the better it is for them to figure out what's going on. So keep that timeline in there. Lastly, keep a notebook and a pen in your healthcare folder. You don't want to scramble at the last minute trying to find one, so make sure it's in that folder so that it goes with you. Okay? And if one of the healthcare providers is taking your timeline or taking your health form, make sure they copy it and give it back to you so that you can give it to the next specialist that walks in the door. Because trust me, there will be many. Okay? The problem with the current healthcare system is this. When you go into the hospital, there's lack of continuity of care. Let me explain. You may have one doctor coming on shift when you are there. You may have a second doctor coming on shift as you go upstairs to the room. You may have one doctor coming in at night to admit you. You may have a different doctor coming in the morning to check on you. So you are the coach of this game. You keep track of everything that's happening to you with your notebook. And if you're too sick to do that, my recommendation is tag a family member, one person who is your advocate. Have them on the phone, have them on FaceTime or Skype. Make sure they're available so that when you have a doctor visiting you in the hospital room, which is usually 4 a.m. in the morning for some reason, so have that person tune in and write down what the doctor is saying. What is the test that's being done? What is the procedure that you're being consenting to? What are the medications being administered? Can you ask questions about whether those medications are appropriate or going to interfere with anything that you're already taking? Don't be afraid of asking questions. I'm going to say it again. Don't be afraid of asking questions. You're in fight or flight. The doctors and the nurses that are taking care of you are also in fight or flight. You're anxious. They're crunched for time and maybe impatient. We're all doing the best that we can. So when you slow down and you tell your doctor or your nurse, hey, I'm really scared. I'm really anxious about this. When is a good time where maybe you could come by and sit down and really explain everything to me? When you approach it that way, your caregivers will stop, pause, connect with your energy, recognize that there's a need for compassion, and then schedule a time when they are available to talk to you, whether it's FaceTime with your doctor or Skype or a virtual call. In these days and times, this is available to you, so make sure that that happens. Be your own advocate. Ask the questions. What is this procedure that I'm having done? What is this form that I'm signing? Usually it's HIPAA compliance, usually it's consent to procedures. You want to ask those questions. What is this test that I'm having done? And when will the results be back? And if it's been a day and no one has given you the test results, ask them. I know a lot of times we don't want to get in the way. We don't want to be the bad patient who's pestering our caregivers. We don't want to seem like we're rude, and you don't have to be rude, but you do have to ask the questions, because the assumption on the doctors and the nurses side is somebody else has already given you this information, or you already know. And so misunderstandings and lack of communication is the number one cause of medical errors. So we want to make sure we keep that open line of communication. And as patients, I want to give you that responsibility of making sure you understand everything that's being told to you, every medication that's being given to you, every test or procedure that's being administered, and the results of those tests or any diagnosis that's been made. Okay? So don't be afraid to ask those questions. Write things down. When we go into fight or flight, when we are sick, when we are in survivor mode, when we are scared for our lives, our higher thinking, our cognitive, processing, analytical, memory brain shuts down. This is normal. All of us go through this. So when you don't remember what's said to you, that's normal. But if you write it down, or you tell someone to write it down for you, then you have time to process this information later on. So important to make sure you understand what's going on and that you stand up to ask the right questions. Second, sometimes you may not have a good fit with the caregiver that's coming to take care of you, the doctor, the mid-level, or the nurse. You may have conflict. It's okay to say you would like a second opinion. I know it's tough. We don't want to be the bad guy, but it's okay to ask for a second opinion. If you're scared and you need more time to think about the procedure, it's okay to say, hey, I need a little bit more time. I don't feel like I understand this thoroughly. Is there any way I can get a second opinion? Okay? And remember, we're professionals. We get this all the time, and personally, I would not be offended. I would actually invite that second opinion, so make sure that you ask for it. Okay? Another important thing. Remember to ask for your doctors and your specialists' names and how you can get a hold of them. Have the nurse write it up on the dry erase board or write it down in your notebook. A lot of times you're going to see multiple doctors and you're not going to know who came, who left, what they said, where they're from. So make sure you ask, excuse me, sir, what's your name? What specialty are you? How do I get a hold of you if I have further questions? Maybe it's a portal that you engage in. Maybe it's an email. Maybe it's their office phone number. Maybe it's a business card that they hand you. Make sure you keep those, because that's a really important way of keeping that line of communication open. Yes, Joyce, I'll be posting this live so that you can share and you can watch it again from the beginning, okay? And feel free to ask questions. I'm watching the screen as I'm talking, okay? Every doctor and nurse should introduce themselves. That is essential. It is not a negotiable. You have to know who's taking care of you. A lot of times the nurses will put their name on the whiteboard. That's good. You want to make sure who your morning nurse is and who your night nurse is and who to contact if you need help. The doctor should do the same thing. Now, I know that there are doctors that are rotating in, and so there may be a service, and that's okay. Ask them for the number for the service in case you need to contact your primary doctor who's taking care of you, okay? All right, test results. Sometimes we doctors can use a lot of medical jargon, okay? We have our own language, just like we have our own handwriting. And we assume that you know what we're talking about, okay? We may say, your tests were positive, and you may think, wow, that's great. Unfortunately, positive means abnormal. So in medical jargon, we may say things that you might not understand. And remember, medical literacy is the number one reason for misunderstandings. So if you don't get it, you don't understand it, ask. Say, hey, can I just repeat back to you what I heard you say? I heard you say that my tests were normal. And the doctor will be like, oh, no. That's not what I meant. Your tests are positive, meaning you have the infection, okay? So really, really important to clarify by repeating back what they said. Okay. Let's see what else. Questions upon discharge. Okay, so really, really important. This happens to me all the time with my patients. They're on a set of medications before they go to the hospital. All their medications are changed. Patient has no clue. And then they're sent home and they take both the medications before hospitalization and the medications that were prescribed during hospitalization. And unfortunately, that would be the wrong thing to do. So getting proper discharge instructions, knowing exactly which medications you should be taking after discharge, super important. What medications you need to take from before the hospitalization, super important. Not only should you read them, you should read them back to the nurse. This is what I need to take, this is what I need to take, this is what I need to take. I didn't mention supplements, but make sure that your list of supplements are also in your history form, okay? And make sure you let your doctor know if you're taking any natural supplements because they may interfere with the prescriptions or the treatments that they're planning. So make sure you please put those down. They are considered medications. They can alter the way certain medications are absorbed, or they may interact with certain medications, so knowing your supplement list is super important. Okay. Discharge instructions, super important. Follow-up. So let's say you healed from this infection, you're discharged, you need to know who's going to see you outpatient, when are they going to see you, are you going to call them, are they going to call you, what's the process? Because you don't want to be in limbo for too long. You want to make sure that you have follow-up with either your primary care or the specialist that saw you in the hospital right after the hospitalization. Okay, so important. Portal access. The Mayo Clinic has an excellent portal system. I had to use it for my sister when she was in the ICU and had to be her medical advocate. I was able to communicate with her specialist. I was able to see her lab results in real time. I was able to see her echocardiogram and her CAT scans in real time. So they do an excellent job of providing portal access. Remember that your doctors should be providing you with portal access. Use it. If you have questions, if you're not sure about instructions, contact them. If you haven't gotten test results, don't assume that they're normal. Sometimes, remember what I talked about with lack of continuity of care? One doctor comes on and the other doctor leaves. That doctor coming on may think that the doctor who left saw the test results and that test gets missed. So know what tests have been done and then check marks those tests as you get those results back so you know what's been done and what's normal, what isn't. And if you don't know if it's normal, ask those questions. Okay. Don't be afraid to tell them that you're anxious and that you need more information. And don't underestimate the power of community. Just because you can't have your family in the hospital room with you, please keep in touch with people. Human connection is very important to healing. We all have an energy that we share with each other, and having the comfort of loved ones, whether you pack a bag with a photo to put by your nightstand, or a personal item that brings you peace, or you bring yourself headphones so you can listen to songs or hymns or meditations, whether you have a book that brings you joy and peace, anything that you can bring with you. Make sure you have a pair of pants and fuzzy socks because it gets cold in the hospital, or maybe a shawl because you can't really put a jacket on with the gown and the IVs, so maybe something you can cover up with because it does get cold. But community is super important. Making sure that your loved ones have constant contact with you, whether on the phone or Skype or FaceTime. Making sure that you've got advocates when you can't advocate for yourself. Making sure that you've prepped and planned all this paperwork beforehand so that you don't have to struggle to try to recite back your history. Make it easier for yourself, okay? And then, yes, please respect the nurses the ER staff, the doctors that are doing their best to take care of you. We are all suffering. We are all struggling with fight or flight. We're all dealing with a very stressful situation. And by all means, please don't hesitate to tell them how worried and anxious you are and to thank them for the work and service that they do, because that's only going to get you some bonus points. All right. So lastly, my biggest advice to you is mental attitude. Your mental attitude, by far, is the biggest asset that you have in positive health outcome. If you go in it with a positive mindset that you got this, that the people caring for you are there for you, that you're going to see the other side of this, you're going to be home, all of those things is going to help you navigate a better outcome. Now, there was a study out of California. Kaiser Permanente did this study on patients going into surgery. And what they found was that the patients that engaged in guided imagery right before their surgery, they had tremendous benefit. Decreased complications, decreased blood loss, decreased overall cost, decreased hospital stay, just by doing guided imagery before their operation. There are studies to show that when patients were admitted to the hospital and had a window where they could look out into nature, they had shorter hospital stays. So our mental mindset plays a huge role in boosting our immune system. But remember that your fight or flight, you're getting stuck in the sympathetic system, shuts down your immune system and can worsen outcomes. So the one thing you have control over, you may not have control over everything going around you. It may feel like you're the eye of a hurricane. But if you can find that center calm, if you can connect to your body and your breath in this present moment, and you can guide yourself through practices like meditation and breath work to help cultivate an inner calm that's going to give your immune system the best chance of fighting off any infection. So you're doing your part by being calm, being informed, bringing the right information to your doctors, by keeping an open line of communication, by asking questions, by being an active participant in your healthcare. And what your doctors are doing is taking that information, streamlining it with the knowledge that they have to give you fast and efficient care, okay? And if by any chance you have any concerns about what's being done or what's being said, don't be afraid to ask. That's my biggest comment there. So I hope this was helpful. That's everything that I have today. Please share with anyone who can benefit. It's my mission to empower you with knowledge so that you can take better care of yourself and you all be safe. Till next time.